Good morning. It's an absolute pleasure to be here, and I'm really excited to announce to you today the launch of the ECDC Lighthouse, an online platform that will provide a virtual space for people in the EU and EEA who are working on social and behavioural sciences for infectious disease prevention. The idea for the Lighthouse arose out of the pandemic, when colleagues in many countries were working to use their social and behavioural science expertise as part of the COVID-19 response. But even though much of what they were doing was really good, many potentially important and useful findings were not incorporated into policy and practice. There was simply no critical mass of expertise and capacity, and there was also often insufficient recognition of the added value of this work in the minds of decision makers as they considered the best ways to bring COVID-19 under control. As a social scientist myself, working at ECDC through those difficult days, I saw a number of missed opportunities, and I wished for a system that would have brought more of these important scientific findings on board. And I know that there were many other colleagues across Europe with similar feelings. For those of you who don't have a background in social and behavioural sciences, I'd like to explain a bit about what they are and why they're important. These sciences include a range of complementary disciplines, such as anthropology, sociology, health psychology, political science, implementation science. And in different ways, they all focus on the many factors that shape health-related behaviours at individual, community, and societal levels. Each has its own models, theories, and frameworks to understand and explain these behaviours. Human behaviours are complex and influenced by factors and constraints that have little to do with viruses and bacteria, and much to do with the social and cultural contexts in which we live. And if we don't understand these contexts, implementation of prevention interventions that focus on health behaviours will inevitably and always be suboptimal. So while I was disappointed, I wasn't actually especially surprised by the relative absence of social and behavioural sciences in the COVID-19 response. Historically, infectious disease prevention has based itself primarily on biomedical and epidemiological expertise, and it's rarely taken systematic account of social and behavioural sciences into the development of policies, services, and communication activities. But things are changing. So does ECDC now integrate social and behavioural sciences into our work? The answer is yes. Under the extended ECDC mandate, we have a new prevention framework that includes a specific focus on social and behavioural factors. We now have a team of 5 social and behavioural scientists, including myself, and today we are launching the ECDC Lighthouse, which aims to transform a patchwork of professionals, often working in relative isolation, into a well-connected network of social and behavioural science across Europe. We're really excited about this. But before giving you a sneak peek, let's see what some of our colleagues have to say about the Lighthouse.
Behaviour matters in public health. So when we understand what drives human behavior and we understand the social and cultural factors at play, we can create more effective policies, better outcomes, and a healthier world. So I'm very happy about the launch of the ECDC Lighthouse, because I believe this initiative will advance the integration of social and behavior sciences in public health policymaking and ultimately contribute to more effective and sustainable infectious disease prevention efforts in Europe.
As an early career professional, I'm very excited to learn about the diversity of projects and methods used in social sciences for public health. I think that ECDC Lighthouse will be a great place to connect with like-minded professionals, to explore career options and feel part of a community.
Behavioral and social scientists are working on complex issues such as antimicrobial resistance, One Health, preparedness. And I think this Lighthouse community initiative will allow them to more rapidly share their results and key insights and tools to further advance research quality. And importantly, I think it will challenge, hopefully also, researchers, policymakers, and practitioners to translate those findings into actionable recommendations for health policy and communication.
We know from reporting, from interview studies with member states, that public health authorities urgently need to build capacity, skills, and structures that allow them to use more evidence-based and more effective approaches to critical health behaviors, and creating a platform for country sharing, for country learning, will be essential to meet that need.
If we want to understand why certain health-related behaviors and decision-making processes occur, we need to approach the infectious diseases in a multidisciplinary way and work together, epidemiologists, sociologists, anthropologists, psychologists, etc. And I think that this ECDC Lighthouse is giving us a great opportunity to do so.
The literature clearly shows that in Europe, the drivers of antimicrobial resistance are primarily behavioral and especially social culture. ECDC Lighthouse will therefore be an invaluable source of support and assistance to healthcare professionals in their interventions to address antibiotic use, as well as improve infection prevention and control practices.
The ECDC Lighthouse is going to be a great resource for inclusive health advocacy. It promises to be a dynamic space where we can connect, collaborate, and share strategies across Europe. I think it will help us to build stronger, more inclusive interventions that benefit the health of all of our communities. So I look forward to meeting you at the Lighthouse.
It's inspiring to see such an interest in the Lighthouse from such fantastic colleagues all across Europe. And indeed, we have had over 400 people from across Europe expressing interest in joining the Lighthouse. With registration now open, people are already creating their profiles on the platform, and the community is coming alive. But what exactly will we be offering? Here are some of the things we've got lined up for members. You will be able to participate in informal networking opportunities, ask the expert sessions, and discussion fora about topics that you, as Lighthouse members, will have helped us to identify. There are groups dedicated to discussing vaccine-preventable diseases, antimicrobial resistance, diseases related to the Sustainable Development Goals and outbreak response. And more discussion groups will be established based on needs and interests arising in the community. For the training, we've already had 3 very successful webinars in our ongoing series, including a fascinating discussion 2 weeks ago about trust in public health. These webinars are open to anyone, anywhere, as will be the introductory e-learning that we're developing, and that will provide a broad overview of social and behavioral sciences for infectious disease prevention. There will also be a more advanced online training for a smaller handful of Lighthouse members nominated by their countries. And finally, we'll be including a living knowledge base, a library of resources and good practices, some of which our Lighthouse team will have identified, and some of which will be suggested by Lighthouse members. And it will be curated and grouped in disease or other interest areas for easy access. So, what's stopping you? If you have an interest in or experience of social and behavioral sciences for the prevention of infectious diseases, even if you don't consider yourselves to be an expert, and if you would like to pursue this with colleagues from all over Europe, please join the Lighthouse. Just visit the website or follow the QR code. And if you miss this now, you can visit the ECDC info stand, where we will also have these available. You don't have to be nominated. You can just sign up if you'd like to join us. Onboarding sessions will be held to guide you through the platform and show you all the things that you'll be able to do. And exciting news, in the coming few weeks, we will also be launching a Lighthouse app, which you can download onto your phone so you can access the platform when you're on the move or away from your desk. So let's work together to harness the full potential of social and behavioral science for the prevention of infectious disease. Through this, we will ensure that good interventions, whether vaccination, hand washing to reduce AMR, or the use of PrEP to prevent HIV, are more acceptable, more equitable, and better utilized. This will lead to better health outcomes for all, and indeed, to a better world. Thank you for your time and attention. Join us at the ECDC Lighthouse. We can't wait to see you there.